Our next presenter is Kate Buchanan, Dr. Kate Buchanan. She is a Postdoctoral Research Fellow in Midwifery at the ECU School of Nursing and Midwifery. Kate's research area is midwifery philosophy, theory, and ethics. She's a qualitative researcher with experience in action research and implementation science. Beyond all of that, Kate believes that she's a butterfly.
Thank you for that introduction. And yes, I think I just walk lightly on this earth. Thank you for the introduction. I'd like to acknowledge the First Nations grandmothers who have been birthing on country for thousands of years, and I'm reflecting on their traditional ways of knowing. Today I'll be presenting our research on midwife-led birth debrief and the importance of standardising, implementing and proving effective this birth conversation. Thank you to the WIRF Foundation that has made this exciting work possible, and to Phoebe and Leanne from Fiona Stanley, and to my mentors, Professor Sarah Bays, and to Peter Fisher, Associate Professor Peter Fisher from Fish as well. So this work responds directly to the rising rates of birth trauma and the New South Wales 2024 state-led inquiry into birth trauma, and which recommended integrating a midwife-led birth debrief. So while implementation has begun, so for example in the WA handheld record, there remains a lack of guidance and clarity around what a birth debrief is. So firstly, this intervention, just so as to not worry anyone too much, is different to a clinical debrief. So you might know that a clinical debrief is where a woman has had an unexpected outcome and she's debriefed by the obstetrician, the accoucheur, probably the clinical midwife, and they go through the notes. It's also different from a psychological debrief, where a psychologist has been referred to and they do birth trauma counselling. Rather, this conversation has been happening for millennia between a midwife and a woman about how she felt about her birth. It's impossible for midwives to separate the psychosocial and holistic parts of a woman from the physical. And that's because we recognise birth as a transformative life experience that changes a woman and family's life. So this conversation between the midwife and woman helps the woman both understand what happened during the birth, but also to refer to that clinical debrief with the obstetrician or referral to psychologist. But in recent years, this conversation has been falling away, and it's because some people have said midwives aren't allowed to do this debrief, and others just simply because postnatal wards are too busy. So when midwives lead research, the questions we ask are different, and so are the outcomes. And the outcomes aren't incidental. They're often related to women's experience, their psychosocial aspects, about being with women in ways that systems sometimes can overlook. So ideally, we'd stop looking at those outcomes as soft data. They're evidence of an attuned practice that makes all the difference to a woman's transformative journey of pregnancy, childbirth, and postpartum. So to begin this study, we first had to figure out what is a midwife-led debrief. So we did a systematic literature review and concept analyses, and I'm sure you've been reading the slide, which is there, the results. Okay, so the aim of our study was to assess the effectiveness, accessibility and feasibility of the midwife-led debrief in one tertiary setting. So to the intervention itself, well, in the 80s, Mitchell and colleagues set about a 9-step process to debriefing, and that was used in trauma settings like ambulance and police. And then in 2005, Gamble & Co. developed a counselling tool specifically for midwives to use with women who have had some sort of unexpected outcome. So together with the midwifery team at Fish, we adapted the intervention and captured this normal conversation that we have to suit our context, standardise the intervention so that we could then measure its effectiveness. The debrief guide has 5 key points: creating a safe space, acknowledging and addressing the woman's feelings, clarifying any misunderstandings, fostering a positive coping strategies, and exploring solutions and referrals. So you can see it's an intervention and a screening tool all in one, with a woman-centred approach being the most crucial point. For example, if a woman identifies that she is traumatised by her birth and she doesn't wish to talk, referrals and other supports we are able to put those in place. So the methods we used for this study was a type 2 hybrid effectiveness implementation design, and this is a part of the implementation science family, and basically is testing effectiveness and feasibility at the same time, which reduces that evidence to practice gap. The design included 4 stages. We conducted a focus group with consumers, midwives and managers a couple of times through the early stages. We implemented the intervention, measured outcomes and confirmed feasibility with the staff and consumers. The study population and sample, there's our 4 groups there. And it was the midwives who implemented the debrief guide, and that was our family birth centre and our visiting midwives, because we noted that it was unfeasible in the postnatal ward. We collected data from January to July, and we recruited 108 postpartum women, and we analysed the results using descriptive statistics and descriptive thematic analysis. This is the demographic data we collected. And then we implemented a survey which asked questions of the women about their debrief experience. And it covered everything from their emotional strength, problem solving, and overall satisfaction. So this is a validated survey which we adapted for the maternity context, and that has been used by other authors. And now the results. So you can see that about 50% were first-time mums. 50% had had the continuity of care model from a midwife, and 70% had a vaginal birth. And so excitingly, this graph shows that the participants mostly agreed or strongly agreed that the debrief was beneficial. The highest satisfaction scores were related to, I wanted to talk about my birth with a midwife, and I had opportunity to ask questions about my birth. These pie graphs are a small snapshot of 3 of the questions it was beneficial to talk about my birth, and you can see roughly 80% had said that, agreed or strongly agreed to that they'd wanted to talk about their birth with a midwife, around 80%. And then the problem-solving pie graph, you can see the participants have mixed feelings about this one. And that could be that problem-solving may not be such an issue for the woman in that 1 week to 6 week window, or maybe we need to do that part better, that part of the debrief better, or maybe our survey question needs to be adapted better and we would need to recruit larger participants to validate the survey for maternity. But this aspect is probably the most important part for the midwife, because it helps the midwife bring closure to the conversation, identify a way forward, positive coping strategies, or the referral aspect. Other questions that we'd asked was self-identified birth trauma or self-identified mental health issues. And our data revealed 15% of respondents had said they did have birth trauma and 20% had mental health issues. And this correlates with the latest 2025 aggregated data on these 2 things. So we did Pearson's correlation coefficient, and although the correlations were modest, birth trauma history and pre-existing mental health diagnoses were significant. We found a weak positive correlation between birth trauma and that desire to talk about the birth. In other words, women had wanted to talk about the birth if they'd had self-identified trauma. We also found a weak positive related to benefit, So women with trauma had a greater benefit from the debrief. And the other interesting correlation was a weak negative related to the time question. And that may demonstrate to us that women with birth trauma probably need more time to talk about their birth. Other interesting correlations we found was that birth mode had the strongest predictor of debrief satisfaction, and continuous midwifery care had the highest overall satisfaction for the debrief across all questions. And then the descriptive themes, we coded to 3 levels, and which resulted in these 4 themes from the written responses we'd given an open text box in the survey. And these were related to emotional safety, therapeutic relationship, matrescence, and empowerment. And now I'm going to just share the women's voices, so bear with me as I read these directly. Related to theme 1, one woman said, "By talking through my birth experience with my midwife, I got to make sense of the moments I did not understand at the time. I got to re-experience the joy from the joyous moments." Another woman said, "My midwife was aware of my medical history, my birth plan, my expectations, so being able to discuss outcomes with her was beneficial. The birth was intense, emotional, and did not go to plan. Debriefing with my midwife meant I was able to express my feelings about the birth with someone who understood me deeply. She was able to validate and reassure my emotions, and she helped reduce anxiety and guilt with how it unfolded, and I felt incredibly supported by her." The second theme, one woman said, "It allowed space to understand what actually happened during the birth and why certain interventions or monitoring was required. It allowed space to understand the terminology and the processes and why certain decisions were made." Another said, "I was really encouraged to hear the midwife's professional perspective on the birth and to gain greater appreciation for and understanding of what my body had done. I was encouraged to ask questions and discuss how I felt." Related to theme 3, one woman said, "Although hundreds of women give birth, it is such a big event and life moment for me. It's good to have someone who understands your journey through pregnancy and motherhood and to vent all your thoughts and feelings to, who isn't going to have a biased opinion." And another said, "As someone who felt reasonably positive about my birth, I think this was still a great opportunity to discuss and process such a huge life event." And theme 4, women's one woman said, "Debriefing with a midwife after birth allowed me to process my emotions, clarify concerns. It helped me heal emotionally, address any trauma, feel empowered and informed for future births. The midwife's guidance and support helped me reframe my negative experiences, fostering a positive and celebratory perspective on my birth journey." And finally, the final woman said, "The debrief with our midwife was, in my opinion, absolutely essential and pivotal in my recovery, both mentally and physically. The care for my well-being throughout pregnancy and the debrief made me feel so much more confident and reassured as a first-time mum. I can't explain how beneficial it was." We've just collected preliminary data from the midwives, and you can scan those there. And then takeaways. Finally, thank you again for the grant that provided this opportunity to pilot this intervention. The results are exciting, with potential to prevent birth trauma when bundled with other strategies. 4 sites across Australia have expressed a wish to use this protocol and debrief intervention, and we have plans in place to apply for a Cat 1 grant funding to continue this research across 4 states, and that's including with our consumers as well. And we also recognise the importance of providing care with debrief and trauma-informed education and training. And finally, this research did highlight the role of continuity in midwifery care for psychosocial wellbeing. And thank you all once again for making this research possible. Please come and chat to me.